Hello friends, I'm Dr. Pradeep Tiwari, and once again after a long time I've come up with a video in view of certain rise in COVID cases that has occurred in last 2-3 months in India. I want you all to know that this COVID second wave is quite different from the first wave, and the epidemiology and the way it is being affecting people is quite different in this second wave as compared to the first wave. Firstly, I would like to tell you that as in the first wave, a lot of patients were asymptomatic. In fact, I had even mentioned that around 85% patients are asymptomatic. But with this COVID wave, we are seeing that more and more patients are becoming symptomatic. So that rule of a lot of patients being asymptomatic and very few being symptomatic is not true now, considering the current situation. In this wave, it's more likely to be symptomatic case as compared to the previous first wave of COVID-19. Also, we saw in the first wave that a lot of mortality was belonging to a particular age group beyond the age of 60 years or maybe 50 years. But this is not again true for the second wave, because in second wave, a lot of young people are also having severe lung involvement, and even they have a poor outcome and have a long-term effects or sequelae of COVID that we are seeing is again being common in the young age group in the second wave. Death has been around same at around 3 to 5%. That has been the death rate, but definitely there are more patients who are symptomatic, and there are a lot of them, even if they recover, they have some or the other sequelae, which is a big observation that is seen in the second wave as compared to the first wave. Also, this time we have vaccination to protect ourselves in the second wave, but then let me tell you that vaccination is basically rendering the disease to be a less severe one, or maybe after a vaccination, if you have a COVID infection, you are likely to have a minor infection as compared to those who are unvaccinated. But vaccination does not provide you immunity from infection, and you are very prone to getting infection. Only because of the presence of antibodies, maybe the disease severity will not be so much as compared to an unvaccinated person. Also, certain epidemiologists believe that a mass scale vaccination in this particular case of pandemic, especially involving the COVID virus, will promote the virus to have a mutagenic effect, and with the antigenic drift and antigenic shift, it may actually evolve to become a more infective virus that we are seeing is actually happening. And probably vaccination is somewhat even responsible for it, because COVID virus is not a new virus, and it has mutated a lot many times in last decade. It has caused the SARS, it has caused the MERS, and small outbreaks that used to take place here and now and then. We have seen that in last decade, but every time we had seen a scenario where the mortality rate was high, like in SARS or MERS. The mortality rate was high, the infectivity rate was not as much. So we actually curtailed the disease, we actually stopped the pandemic, we actually prevented it from causing a large scale damage. But in this virus, it is a very highly infective, and because of this, it is very difficult to curtail it to a particular place. And now, as mutations are happening, it is even becoming more and more pathogenic, like the previous strains. It is becoming more and more pathogenic, it is causing more and more fatality, it is causing more and more morbidity and mortality issues. So that's one thing that I want you to know. A lot of people are telling whether should we take vaccination or not. No doubt, vaccination on the long run may be promoting a virus mutation, but definitely on individual scale, it is preventing you from a severe disease. So I would still recommend you to go for vaccination. And out of all vaccines that are available in market, Covaxin has been very effective in the trials. Only thing in Covaxin, you need every 6-month booster dose for enhancing your immunity. It does not give a lifelong immunity. Any vaccine for that matter does not give a lifelong immunity, because the virus is continuously mutating. So I think Covaxin is having a good idea of a booster every 6 months. So they can change the booster, they can change the strain of the virus in the booster dose if they want to, and that's how they can actually cope up with the new strains that are coming up. So let's see how it goes about with this Covaxin. But on the trials, it's definitely better than the other two, that is the AstraZeneca Covishield and the Sputnik 5 that are currently available. So for those who basically want to know which vaccination, Covaxin is the vaccine to go with. Treatment modality hasn't changed since last wave, and now we know that either azithromycin, hydroxychloroquine, or ivermectin plus doxycycline, that's the combination of antibiotics that we need to use. One very important thing is dexamethasone, as I mentioned in last video itself, that after the replicative phase of the virus, there's an inflammatory phase that comes up, and in inflammatory phase you are having a lot of complications, you are having a lot of sequels like the lung fibrosis, like the stroke, hypercoagulable states. So these things are basically prevented from dexamethasone, which is the drug of choice and the main drug to go with if your inflammatory markers like D-dimer or CRP or interleukin 6 is high, then dexamethasone is the drug to go with. So that's one very important point. Certain antivirals have been again being promoted. Remdesivir has, as per physicians' knowledge on the trials, it is not shown to be a very effective drug, but physicians who have used it are claiming that there's a better outcome. We still don't know. We still need a lot of study and a lot of perspective studies and as well as retrospective studies to finally come to this conclusion. But as of now, remdesivir is running out of stock, and there are central helpline numbers. There's already black marketing of remdesivir going on. So there's central helpline numbers to call where you can actually call and check for availability of remdesivir. So the treatment, as I already mentioned, is mainly the antibiotics, the dexamethasone, and as some people are right now mentioning about remdesivir, as I already mentioned. Another important thing is that it has been seen that if people have a lower saturation, the chances of getting lung fibrosis as a sequelae is high. So if you are having a saturation drop of 3%, or maybe your saturation is somewhere around 92 and 93, is still advisable to be on an O2 support to prevent long-term lung fibrosis and other sequelae of the disease. And the first and foremost thing that is taking all the precautions, taking an adequate diet rich in protein, regular use of vitamin C, zinc containing multivitamins, that's totally advised, and that should be continued throughout this period. Also, you should have all kinds of precautions like the N95 mask, the sanitizers. They should be used very effectively. And seeing the current situation, I think lockdown is very imminent. Though we will have some shortage of the economy, there will be some drop in GDP. But then, if we need to get out of this current situation, I think it's very imminent to have a lockdown, and the government should be thinking about it sooner or later. So all the wishes from my side. Take care. Be safe.